coming in.
Can I come in, please?
Yes.
Okay. Hi, my name is Brianne Smead, and I am a practical nursing student. How are you feeling?
I'm not feeling well.
You're not feeling well. Okay, I'm sorry to hear that. Can you just tell me your first and last name, please? I'm just going to compare it to your armband here.
My name is Henry Johnson. My date of birth is January 28, 1980.
Okay, thank you very much, Mr. Johnson. So I'm just going to set up some privacy here. I'm going to close our curtain, okay, and I'm going to make sure that our brake is on. And I'm just going to put up the bed rails so that I can move the bed up to working height. Mr. Johnson, do you have any allergies to anything that I should be aware of?
No.
No? Okay. So you mentioned that you weren't feeling well. Can you tell me a little bit more about that?
Last couple days I am not able to void, and I am feeling, my abdomen is flooding soon.
Okay. So I do see here that you've been retaining some urine, about 800 milliliters. Okay, so I'm going to be inserting a catheter. That will help to make you more comfortable. It will relieve some pressure, but it will also make sure that you don't have any long-term damage, like damage to your kidneys or your bladder or anything like that, okay?
Okay.
Have you had a catheter before?
Yeah, I had last year.
Okay, and how was that?
It was discomfort, but it helps.
Okay. So I'm just going to lower the bed rail down here so I can work from a good position. And I'm going to sanitize my hands, and I'm just going to put on some clean gloves, okay?
Okay.
Okay, so I'm just going to be exposing the area that I'm going to be working from. So I'm just going to pull down your bed sheet. Is that okay?
Yes.
Okay. Okay. There you go. Are you comfortable?
Yeah.
Okay, I'm just going to try to move your legs a little bit. You just let me know at any point if you feel uncomfortable, okay?
Okay.
Okay, so I know I asked you about allergies. I just wanted to double check. Do you have any allergies to latex?
No.
No. Okay. And I'm just going to place a blue pad underneath you, okay?
Okay.
Hello, my name is Debbie, and I'll be narrating the procedure of catheterization.
Okay.
Okay, there we go. Okay, so
Position patient appropriately and drape the patient appropriately for privacy and for the procedure.
Okay, before we start the procedure, do you have any latex allergies at all?
No.
No? Okay. So I'm going to put some of my supplies just here on the bedside for now. Okay. Normally I would drape the patient, but just for viewing, I'm just going to leave everything kind of open, but you can put a towel along the patient for comfort. Okay? Do you have any questions for me before we get started?
No.
No? Okay. So I'm going to perform hand hygiene.
Hello, my name is Debbie, and I'll be narrating the procedure.
Open my kit.
So she's opening her outer wrap of the catheterization kit.
Okay.
Okay.
I'm just going to grab my forceps. Now I'm just going to add the garbage bag from my kit to the bed for a spare garbage there. Okay.
Okay.
I'm going to take my 4 steps and just put my sterile drape onto my sterile field because I'm going to be needing that. Okay, and then I'm going to open my catheter and I'm going to be keeping the tip sterile. I'm just going to be adding it to my sterile field. Move my table here.
She's keeping that aseptic technique. She stepped back.
We're all good. Keep the cuff.
She's doing the scoop method. Pac-Man.
Okay.
Amazing. Okay. Next, Brienne will be working within the sterile field to open the foley bag. The foley, take it out of the bag.
I'm just gonna put these spare gloves here to give us some room, but those are there in case I need them.
And she's going to leave the part that will be inserted into the meatus just soaking inside the loop. And then she'll take the rest of the foley out of the bag before putting it into the box. Amazing. Okay. Next, she will be draping the patient carefully, making sure the gloves stay sterile. Wonderful job by Brienne. Next, she will be attaching the flush to the catheter to then later inflate the balloon. On the foley bag, we saw that it's inflated with 10 cc. So that's what she will be doing, as there's 10 cc in the syringe. Okay, and then she'll be placing that back into the box. And then from there, she'll be grabbing it from the inside and carefully placing it in front of our patients. Yes, she'll be opening up the swabs and giving the patient a couple swabs in the meatus, opening up the culture and sensitivity test.
So I'm going to keep my dominant hand sterile, but I will be touching the patient with my non-dominant hand, so it will just be clean at this point, but it won't be sterile. Just going to secure his genitals and going to...
One wipe one way. And she'll be doing this.
And And I'll be doing my third white to clean.
Okay. Next, she will be grabbing the tip of her catheter out of the loop. And she'll explain to the patient that the catheter will be going in.
Okay, so I'm going to be inserting your catheter now. You will feel some pressure, maybe a little bit of discomfort, but I just want you to take a nice deep breath, okay?
Okay.
Okay, so here we go.
And she's applying an upward traction to the penis while holding it at a 90-degree angle from the body. And then she'll be inserting it until she sees urine output. And we see some urine output right now. Okay, so now she'll be inflating the balloon with the 10 cc. Okay. And we see great urine output, clear.
And I'm just
And
going
yellow.
to detach this.
And then we'll just be attaching the drainage bag. Okay, and then she will be placing the drainage bag lower than the bladder, so there are areas on the bed that you can attach it.
And maybe just fastening it to his leg for comfort.
Amazing.
So I'm going to be attaching to the bed, but not to the bed rails. Okay, I'm going to be removing my sterile gloves. And I'm going to be checking with my patient. So how are you feeling right now?
Yeah, I am feeling okay. I don't have any pain.
You're feeling okay?
Mm-hmm.
Okay, I am going to check on you in a little bit just to make sure that everything is okay. I'm going to tidy everything up here, okay? Is there anything I can do for you right now? I will give you your call bell, but is there anything you need right now?
No, thank you.
No? Okay.
And prior to Brienne leaving, she will palpate the bladder for distension.
Okay, so I'm just going to put on some, I'm just going to sanitize my hands. Just going to put on some clean gloves. So I'm just going to be palpating your bladder to see if the catheter has helped to relieve the pressure and the amount of urine in your bladder. Okay, so I'm checking for distension. Okay, feels flat. Okay.
And next she'll be checking the drainage bag and observe for the character and measure amount of urine, ensuring that the urine is not leaking from the catheter or any of the connections in the tubing.
Yep, there's no leaks in the tubing from the bag, and the urine is draining nicely into the catheter, into the bag.
And then she'll remove her gloves, perform hand hygiene, record using a dare note, and recording the ins and outs.
Remove this. We're going to tidy up.
And she will tell her patient to report any persistent catheter-related pain if applicable, inadequate urine output, and discomfort.
Okay, so just let me know if you do have any discomfort at all, but I will be checking on you and I will be leaving the call bell for you, and I'm going to cover you back up here, okay?
Okay, thank you.
Thanks.